So when we talk about tech in surgery, it's primarily in two parts. One is the tech that is used inside the OT by the surgeon, or the tech that is used around the surgery for taking care of the patient and the patient's caretakers. When we talk of the tech that is being used inside the surgery room, that includes all sorts of robots, etc., which is again evolving at a rapid pace, and doctors are bringing newer and newer tech every day. This is the tech which is told to the patient by the doctor. It gets sold as a better surgery and it has its own advantages. And that's the reason why that market is growing at a rapid pace. The other part is the tech around the surgery, which is for taking care of the patient and the caregivers. That is the place where the major disruption is happening, and which is where patients and caretakers require it to innovate, because there are multiple challenges there, primarily around different tech being used by different players. So each hospital today, for example, runs on a different operating system. Similarly, all the insurance companies have different talk. These systems typically don't talk to each other. So it's very hard for any patient to carry data which is interoperable, which he can get at one hospital and take to the other places and show them the same report through digital mediums. So that is the tech where maximum amount of work is happening, because that's where the patient and the providers will benefit the most, and that's what we are also trying to do. So that is the place where the adoption of tech also needed to increase. So hospitals today, many of them use manual ledgers, which are not sustainable beyond a point. So that's again something which is bound to change as time progresses. So what we are seeing there is that these are all the places where growth opportunities are also there, because if there is a player who can actually make admissions faster or make sure that discharges happen faster because the cashless claim can be settled faster, then that adds real value to the patient's life. Similarly, if there is a tech which can show the various categories of hospitals, the various infection rates at hospitals, the various prices at hospitals, then that basically is again something which is required by the patients and which is supposed to grow leaps and bounds in times to come. So the government today is also trying to work in the same disruption area. There is a National Digital Health Mission which is trying to make sure that the doctors actually write prescriptions through a EMR, which can be stored centrally and which can be used by the patients and hospitals in a UPI-like format. And once that happens, the whole process will become much smoother, and there will be further avenues which will come for people to disrupt and for technology to take over again. Thank you.